there are three things that Democrats are asking for here. Number one, with the Trump mega bill, there was a lot of healthcare provisions that passed, cuts that were made to Medicaid. Democrats basically want to reverse all of what Republicans just did only a few months ago. Number two, the White House has done a number of what's called rescissions. Basically taken funds that Congress in a bipartisan manner allocated to various programs, and the White House said, hey, we're not actually going to use that funding. Congress wants that to stop. They allocated this money in a bipartisan way, and they want that to continue. And then number three, they want to extend these premium tax credits that are helping millions of Americans who get their health insurance through the Affordable Care Act marketplace to keep their healthcare costs low. The tax credits expire at the end of the year, and when they do, the cost of health insurance for more than 20 million Americans are expected to go up, according to the Kaiser Family Foundation. Now, we should be clear about this. Of these three things, the first two are no-go. There's no way that Republicans are going to undo what they just did with the Trump mega bill. And frankly, even if Republicans disagree with what the White House is doing with spending and funding, they're not going to really be able to exert the kind of pressure on the White House to get them to stop. So really the entire name of the game here are those Affordable Care Act tax credits, because there is some bipartisan support for getting them done. The entire three things that Democrats are proposing doing does come up to $1.5 trillion. You've heard Republicans say that number a lot. But if we just want to zoom in for a second on those Affordable Care Act tax credits, extending those is estimated to cost $350 billion over the next 10 years. But that's if you just extended them as is. Both Democrats and Republicans have told me they're likely going to need to make changes to the program to get it to advance. Things like adding income caps or trying to root out what they're calling waste, fraud, and abuse. So that could potentially bring that cost a little bit lower.
They want to give healthcare benefits to illegal aliens.
So there's a little kernel of truth in here, but overall, undocumented immigrants, unauthorized immigrants, they're not allowed to access Medicare or Medicaid under current law, and Democrats have said as much. What Republicans did when they did the Trump mega bill, though, is they limited which groups of immigrants get to have access to things like Medicaid, Medicare, and even these premium tax credits so they could buy insurance on the Affordable Care Act marketplace. So there are some groups of immigrants, like refugees, those on temporary protected status, or those who maybe were brought over here as kids and are now adults, who are what are we called lawfully present. So they're able to be in the country, we know who they are, we know where they are. They're certainly not undocumented, but they're not exactly someone who are necessarily on a path to citizenship or have a green card. What Republicans did is they narrowed the number of immigrants who would be eligible for these programs by rolling back the Trump mega bill healthcare provisions. Democrats would once again expand it to include those immigrants and allow them to access various forms of healthcare.